Imagine waking up one morning and part of your vision is gone. No pain, no warning sign, just a shadow where light used to be. Recent headlines have linked Ozempic, one of the most popular weight loss and diabetes medication, to this kind of vision loss. Is it true? Is Ozempic hurting people's eye? Or is this another sensational news outpacing the science? Let's break down exactly what we know, what is still uncertain, what is unknown, what it means to patient and doctors. Ozempic or semaglutide is a GLP-1 receptor agonist. It was proved for type 2 diabetes in 2017 and later in high dose as Wegovy for weight loss in 2021. Millions of people worldwide are now using this drug for good reason. They lower blood sugar, they reduce cardiovascular risk, they are able to lose substantial weight loss first time in their life. But when a medication becomes popular, rare side effects start to surface. Lately, researchers and regulators have been investigating eye-related complications, particularly something called NAION, non-arthritic anterior ischemic optic neuropathy, and a few other vision changes. NAION is a type of optic nerve stroke. Blood flow to the front of the optic nerve gets interrupted and part of the nerve dies. The hallmark is sudden painless loss of vision in one eye, often noticed on waking. The risk increases with age, diabetes, blood pressure, high cholesterol and sleep apnea. In general public, NAION affects 2 to 10 people, 10,000 per year. It is not common, but it's a very frequent cause of sudden optic neuropathy in older adults. And importantly, the vision loss is often permanent. Now let's look at the evidence. In 2024, a team at Massachusetts Eye and Ear Hospital published an analysis. They looked at thousands of patients and found people who are using Ozempic or semaglutide have higher risk for NAION, about 4 times higher in patients with diabetes and about 7 times higher in patients who are using in obesity. That sounds dramatic, but let's keep the perspective. The absolute risk was still very small. Most patients will never experience it. Other research hasn't been clear. A systematic review of 78 randomized controlled trials involving 73,000 patients found no significant link between semaglutide and eye complications. But here is the catch. Randomized trials usually are not powered to detect very rare events. So both can be true. Randomized controlled trials show no clear signal, while big population studies pick up a rare association. That's where healthcare agencies step in. European Medicine Agency added NAION as a very rare side effect of semaglutide on their label, meaning it may occur in 1 in 10,000 people. In Australia, Therapeutic Goods Administration reported dozens of suspected cases, including sudden blindness event. Does that mean Ozempic causes NAION? No, not definitely. There is no cause and effect relationship so far has been established. NAION is not the only eye issue which has been studied. Diabetic retinopathy. In a trial, Sustain 6, the patient with existing retinopathy who had rapid sugar improvement on semaglutide actually saw early worsening of eye disease. This is not unique to Ozempic. Same effects has been found with other medication including insulin. When there is sudden decrease or improvement of glucose, this sugar dip can cause short-term triggers and problems. Macular degeneration. A Canadian population study suggested that older adults using semaglutide had double the risk of developing wet age-related macular degeneration. The absolute numbers are tiny, about 0.2% per year as compared to 0.1% in general population. Blurred vision when starting the medication. Many patients experience temporary blurred vision in the first weeks to month, not from eye disease, but from changing blood sugar level that alter how the lens bends the light. This usually resolves and stabilizes as we go along. So do not stop semaglutide based on headlines. So how big this deal is? Ozempic, we know, can increase the risk of gallstone by 2 to 3%, nausea and GI upset up to 20%, NAION somewhat around 0.01%, very rare. For most patients, the cardiovascular benefits, weight loss, better control of diabetes, preventing eye complication, nerve complication, and kidney complications outweigh the risk. Here is the practical advice I give to my patient. Baseline eye exam if you have diabetes, especially with existing retinopathy. Do not panic about blurred vision early on. It is temporary. Watch for red flag signs, sudden dimming, dark spots, vision loss in one eye. If it happens, stop the drug immediately and ask for eye doctor immediately. Do not stop Ozempic of your own just based on headline. Always talk to physician. The benefits are real. Risk though are rare, could be serious. To be clear, data does not prove Ozempic causes eye strokes. It shows an association worth respecting. Regulators are cautious because these events are serious. For vast majority of people, Ozempic remains safe for long-term use. The key is awareness and communication. If you find this information helpful, subscribe to our channel Kundlas MD for more information. This is Dr. Kulmeet Kundlas signing off. I will see you in next video. Thank you.